All right, everybody. So we're going to focus on capillaries in this video. So we discussed this before, but let's just talk about a few of these terms again. Arteries are going to be usually carrying the oxygenated blood throughout the body to all of the tissues of the body because those tissues need oxygen. So those arteries are going to get smaller and smaller until they become arterioles. Arterioles also have these little sphincter muscles on them that help squeeze the blood. They can either increase the amount of blood to an area or they can stop the blood flow to an area, especially if there's like a cut. So, for example, if there was a damaged tissue right here, these sphincter muscles can just close it and prevent the blood from escaping that little section, right? So, these sphincter muscles are very important. As you continue down the arterioles, as you will in this case, so here's my little arrow, get on the artery, get on this arteriole, we continue. Eventually, we're going to get to this little section here where, like in this picture, you can see it's starting to turn purple. These are the capillaries. Capillaries are extremely small, and their job is to ensure that oxygen can leave the arteriole into the cells, and also that CO2 can enter. And then that deoxygenated blood that has CO2 in it will continue through the capillaries and until it becomes a venule, which is a really small vein. And then all those venules are going to come together into a vein. From there, the veins are going to continue until they get back to the heart. So, this is the whole hierarchy of the capillary circulation artery to arterial to capillary to venule to vein. Here's another image of different sections of a capillary. And again, you can see that we call this a microcirculation because it's so small. Look how small. Again, this is a venule here, so this isn't even the vein. Go back again. So like in this image here, like this is a venule. So this is already smaller than an average vein, and then it gets even smaller into these little capillaries. And this is why specifically these arterioles have those sphincter muscles around them because they connect to so many little capillaries that if there is a bleed, it's important to shut that off to make sure there's no internal bleeding. Where else do you see all of the circulation with the microcirculation of the capillaries? A really good example is places where there is a lot of absorption occurring. So absorption, where you see a lot of absorption, the small intestine, which we'll be talking about soon. The small intestine is really important for absorbing as many nutrients as possible from your food. The endocrine system, there are many endocrine glands that are going to absorb different hormones so that, like we talked about previously, they're going to absorb the hormones so that they can connect to the receptors so they can then release their own hormones. So endocrine glands are important. The kidney is important. And then specifically within the kidney, the diaphragm of the kidney, as you can see here, is another example of a capillary wall that's really thin so that certain compounds can enter or exit the area. And like I said, with the kidney in particular, there's so many different substances we'll be talking about later on, but ions, water, waste products, there's a lot of things moving in and out of the kidney. So it's important that we have all these capillaries that allow for that movement of substances. And not only just moving substances out of the kidneys, but back into them. So in some cases, if you're dehydrated, you want to keep water in your body. So by reabsorbing that water back in, it's really important. And that's only possible through the capillaries. Here's another image. Again, showing these endothelial cells going back to the endothelium unit. You can see that they're very thin. It's one layer of cells right here. It's only one layer of cells. So that way oxygen and CO2 and other substances can just move in and out. Depending on the different pressure gradients, we can see, again, like we talked about before, certain substances entering or exiting the capillary. So it can get very complex, But for purposes of this video, just understanding that substances can enter or exit the capillaries. And here is a nice chart that talks a little bit about all the different components of the blood vessels, going from artery to arterial, capillary, venule, and veins. All right, if you guys have any questions, just let me know.